Are watching the trend of COVID-19 cases on both sides of the state line. In Kansas, the positivity rate is holding steady at 10.2%. In Missouri, 13.2% of COVID tests are coming back positive. And Missouri has a new COVID treatment that could help, and Truman Medical Centers is offering it.
KMBC 9's Matt Fleener is at the hospital to explain the importance of getting this treatment early.
The treatment is monoclonal antibodies. It's given through IV infusion. There's been a lot of talk about this over the past year and a half. This month, Missouri Governor Parson's administration announced a $15 million plan to bring 5 infusion centers to the state.
It's been shown that with these infusions that we can prevent hospitalizations and deaths from COVID. In people who have mild to moderate illness.
Truman Medical Centers and University Health is providing the space for an outside group to provide treatment. You might remember it's the same treatment used on former President Donald Trump during his stay at Walter Reed Medical Center last year. You're eligible if you've tested positive, have mild to moderate symptoms, a high risk of more serious symptoms, and have had symptoms for less than 10 days. The infusion center started Wednesday at Truman Medical Centers. It will run for 30 days.
I would strongly encourage them to call and see if they're eligible or talk to their doctor as well.
Still, doctors say the best way to avoid the hospital is to get vaccinated. Matt Fleener, KMBC 9 News.
All right, you can call the number on your screen to schedule an appointment, 660-829-6647. The clinic does not accept walk-ins.
Wyandotte County health officials are out with some new guidance about gatherings as this Delta variant continues to spread, and this affects everyone, no matter your vaccination status. The county says vaccinated people should limit outdoor gatherings to 25 people. Indoor gatherings should be capped at 10 people. Officials say that you should wear a mask if social distancing isn't possible, and the health department recommends unvaccinated people avoid gathering with anyone who isn't part of their household. They say if you do decide to attend or host a gathering, keep the numbers small and wear a mask. Local health experts say that they understand why Kansas Governor Laura Kelly told state workers to stay home for right now. Chief medical officers from all around the metro joined today's University of Kansas health system briefing. The head of Liberty Hospital says with hospitals packed and new coronavirus cases surging, working remotely might not be a bad idea for other businesses.
It all depends on the job requirements, as you said. There are certain jobs that are easily doable remotely. I think those certainly, it's time to consider those.
Doctors also point out that a whole lot has changed since last year's shutdowns. We have more PPE available, and those vaccines, they greatly reduce your risk of severe illness or death from COVID-19.
New guidelines now on the need for COVID booster shots should be coming, but it's not just the booster that you should be thinking about. KMBC 9's Kelly Eckerman is here to explain what else doctors are recommending right now. Kelly?
Chris, they are strongly recommending flu shots, and it might work out that you can get your COVID booster right along with your flu shot this year. Last season, it was recommended you space out those 2 vaccines. The guidelines have changed. You can now get vaccinated against COVID-19 and the flu in the same visit. With masking and stay-at-home orders, flu numbers were way down last year. That has changed as well. Some states are already seeing high levels of influenza. With hospitals filling up, doctors say it's more important than ever to stay healthy.
Honestly, we worry about COVID hospitalizations. We worry about maybe flu and all of these other things. But somewhere today, someone will have a stroke that needs help. Someone will have a heart attack that needs help. And when our health system and ability to transfer and to move patients and get them to the right setting that makes a difference in their long-term outcome, that's a huge deal.
As for COVID-19 booster shots, the FDA is still reviewing data from clinical trials. The White House says it plans to begin a booster shot campaign by mid-September. And the latest reports are saying that guidelines will probably be for boosters at 6 or 8 months after your last shot.
Kelly, thanks. Let's take a quick look at local vaccination rates. Johnson County, Kansas, now reporting 60% of eligible residents fully vaccinated. Leavenworth County is at almost 50%. Kansas City, Missouri is at 42%.